very quick overview, and Melissa, you could skip right to the DHHS. The mayor alluded to this morning that when we started out in developing DART back in 2017 and 2018, we had a very specific mission, and that was to integrate some form of a response when an overdose occurred, as overdoses were very much becoming far too common and more complex, and there was a lot of desperation by people and family members as well as the provider and service community on how we were going to encourage and start to have engagement, meaningful conversation, and deploy resources. And on the front lines were our first responders. Our first responders were literally seeing this all happen in front of their eyes without necessarily the correct tools and methodology or support, even from outside partners. And it took a bringing of everyone together. Fast forward several years, the DART program really made incredible progress and success, and it's because of every single individual that's been part of this program that was willing to figure it out on the fly, be uncomfortable in the moments when we didn't have all the answers, and develop policies, procedures, and grow together. In that process, as COVID came on, we were a local Northampton Health Department with about 5-6 staff members that had this really amazing regional program we were deploying through our prevention team, my colleague Cherry and myself, that I don't know how we did it sometimes. It was quite incredible, but we couldn't have done it without the energy and all of the amazing people that were making things happen. And because of the COVID response and because a lot of the regional work that we had already laid the groundwork for on how we could work as partners with multiple communities and cross counties, the Mayor Shara, who came into office right as COVID, I think it was right into 2022, decided to convert us into a Department of Health and Human Services. So hence why our name changed. We went from a local health department to a DHHS. That allowed us to also create some distinctions between our divisions, which led to 6 divisions within the Department of Health and Human Services, and a lot of growth these last few years. In that growth, we had the wheel of 6 different divisions, but one of those was also creating the Division of Community Care. And again, we'll hear more in detail about that later today. There we go. But the Division of Community Care wouldn't have been possible for us as the DHHS if we didn't understand how critical the role was of public health and law enforcement, public safety partnerships, and how effective they could be. It really takes multidisciplinary, multi-sector work to look at making any sort of integration into a systems change. Thinking about how we could leverage our strengths, understand the skills, disperse the different roles and responsibilities that we all might have. So you can see here there are 6 divisions in the DHHS. One of them is prevention, which is the home of the DART program. Also Hampshire Hope, our countywide coalition that works closely with HCAT and the Hampden County Addiction Task Force. And we have a wonderful youth health coalition that's led by youth with a youth voice. So we're very proud of that work too, and Karen McLaughlin. So of the prevention division, as well as our public health nursing division and the Division of Community Care, we really leverage our resources. We're able to take what might be better funded one year and not have as much robust funding the next. Think about literal tangible, flyers, postcards, to having events, to trying to bring many different pathways of how people live, work, and need support within the community. So just to ground us all, that is a bit of how the precipice for DART and the DCC coming together really somewhat has been an emerging opportunity over the past couple of years. We traditionally, and I'll make this really quick so that we can move on to the more interesting topics here, is we weren't necessarily providing direct ground service as an NHD. So what we would do is we would work really hard to secure federal funding in the case of the COSUP funding and BJA, as well as SAMHSA funding, and we would redistribute that funding throughout the landscape of our community partnerships. So that looked like contracts with our police departments and our recovery agencies or our harm reduction groups. That way they could utilize those funds to directly pay for staff time or costs that wouldn't have allowed them to be able to join in this work with us, train with us like we all are today. And when we did create the Division of Community Care, it was a new foray for us as a DHHS to provide and cultivate a workforce that we were really looking to bring forward all the amazing skills we learned from our recovery coach partners and the incredible work that they do, add in the layers of work we've learned with tapestry and harm reduction, the social service work that we know is so needed to holistically be able to meet someone on a doorstep and you don't know what they need, and try and bring this all together as a multidisciplinary hub and spoke model in what we're calling the DART community responder and community responders at large. We consider our DART community responders to be specialists and individuals that are intersecting with substance use of concern or people that they care about or have lost a loved one. And that includes our business partners, our organizations that have intersections with people every day in the public. So the DART community responder is not necessarily surprising, probably, for most of you that we have moved this direction. But what we hope to do is to be better at getting people to the experts that were already part of our network and team. So if someone that we reach through a follow-up is looking for recovery support services, we're going to hot hand off them to the recovery center, get them to the peers, get them to the experts that speak the language of recovery. If they are an individual that is still using substances and that is what their choice is, then we will work harder to get them to harm reduction partners and agencies that can help ensure they're using safe. And also wounds and different kinds of health concerns that can come up related to using drugs. Same with behavioral health, same with justice involvement, same with social services like housing, food, and basic needs. So we're really looking at being the navigator, almost similar to the call program, and getting people what they need and better being able to do that in a rapid response fashion. So not a big philosophy change for DART, but a different mechanism of how we approach the work in a whole new workforce that can't wait to get started to support us all moving forward. So with that, I will turn it over to Kathy, who is our DART coordinator and has done a tremendous amount to support this event. And we're very thankful for it today.
Good morning. It's very nice to see lots of faces that I know out there. I am Kathy Catunia, the DART coordinator. As Michelle had said, I think what's important in this process that we're doing in changing our method of doing our DART program is how we're going to really reach individuals post-overdose, but also those individuals who are at risk. We know that we need to do both ends of the spectrum in servicing our individuals in our community. They're our community members, and they need help. And how are we going to do that? And one of the ways we're going to do that is by having our DART co-responders begin going out in the community to reach those individuals at need, do the assessments with them, determine what they want, what do they need, and how are we going to do that. They will work directly with our community police departments that are doing DART to help bring community resources and access to the communities that are out there. Our best people that are available are our police departments, I feel. They know their community. They know who's living in their community. They know what those needs are. And it is a hub place to start for us to bring all the other services together in this program. And that is bringing that public health piece. You know, we look at how we cross-intersect and how we're going to collaborate across the communities. And we know each community be a little bit different. So what will happen is we'll come out and start doing some community assessments with you and determine what those community needs are individually within the communities. Our responders will intersect across this diagram that we're showing you here. I think one of the things that you need to know is the technology and the data sharing piece for us. In April, we'll be launching our new org program. New Org is a case management program, and it's designed to reduce dual data entry. Our officers will continue to enter into SIMs that will come into our case management system. And then within that case management system, we'll have a little higher privacy and HIPAA availability in our new case management system, so that when our DART responders and community responders put in notes after they've visited individuals, that total information will not go back out to the public. It will be kept private so that we can do assessments and help them in their treatment, in their pathways that they choose to go. We've updated our website and our DART online referral portal access to partners, so it will be seamless. SIMs will actually automatically get loaded into our new org program, so that we will see it immediately. It'll come in, I will assess the situation again. It will go out to our DART responders, who will then go out and do our response within 24 to 72 hours. And then I think everybody knows our DART line and our phone number that you can, do individual personal referrals to also. It doesn't have to come from our police departments. It can come from community members, agencies. That is it for me, and I'm going to quickly pass this off to Dave.
Good morning, everybody. Dave Burns from Palmer PD. I see a lot of familiar faces, some new faces, so looking forward to getting to kind of introduce myself to everybody, get to know each other throughout the day. From here, I'm going to just give a brief synopsis about kind of what overflow is, or the workflow for what DART is. So normally we have a referral. From there, we enter into SIMs, and I know it was a frustration for some of us for a period of time that we enter data and we have no idea what happens with it. Anybody else feel that frustration? Okay. So moving forward, and kind of the exciting part of having the partnership with DART community responders and the new program of New Org that's going to be available, it's my understanding that there's going to be a role permission where you can actually log in and see what happens. You're not going to get all of the pertinent details for what's going on because we do have to be compliant with HIPAA, but we will be able to track cases a little bit from that aspect, which will give us some insight into our efforts and what happens on that end. Some workflow-wise, so cases would get assigned to a DART community responder, and we're going to talk in depth about this during our next presentation about what workflow could kind of look like, partnerships that we have, roles and responsibilities a little bit, so I'm not going to dabble too far into that. But the case gets assigned, people will be in contact with you, and there's exciting opportunities and partnerships that can happen down the road with that. Ongoing engagement and disenrollment for the program, so that's another part of the workflow aspects where people either successfully complete, they reach a position of recovery where maybe they don't need us anymore in that regards. There's other disengagement things that could happen, like unfortunately people pass away or they're just not suited for the program or at a point where we're willing to accept that outreach and recovery. So that is a very general, brief oversight of what the workflow kind of is moving forward. I want to take this opportunity to just share a little bit of excitement about community responders. I know one community responder who was a recovery coach before from BHN. Her name is Jess. I don't see her out there. She's probably in a brief bathroom break or something like that, so throw her under the bus there for a moment. Being a TA, we kind of get to see a little of what's coming and get to try things out before we push it out to everybody. So that's kind of a perk in that regard. So when Jess was a recovery coach, DART had a contract with BHN. They were providing some recovery coach services. I had the opportunity to do a lot of boots on the ground outreach and seeing that collaborative relationship and team building aspect that went on, and got to see the hub and spoke model in action, where we are actively referring people to services for housing, for financial issues that they may have, not just focusing on substance use, not just focusing on mental health, but seeing a really good interweaving of what's happening. Share with you some exciting news from the town of Palmer. We are running a community strong wellness event, and what that looks like is essentially a situation table with people from different organizations, different backgrounds, different histories, sitting together, working collaboratively, and we have open office hours where people trickle in from the community in a private setting inside the library, a very neutral place to meet. Our officers are dressed down when we're there. and kind of in street clothes, comfortable clothes. And we've actually had a lot of success. We run it for about 3 hours twice a month, so 6 hours total. During that time frame, we've had roughly 15 people come in. We have only had 4 dates of actually having these open office hours. And it's been pretty impressive looking at the team aspect of what can be done when people work together to achieve goals. We're continuing that through July. It looks like we're going to have a funding source after July through all of next year, which is awesome news to hear, and Jess just trickled back in. So Jess, raise your hand. Hey. Yep. All right. So, but it looks like it's going well. We're getting a lot of positive feedback from our community, and it's good connecting people with additional resources that we otherwise wouldn't think of that are out there. We've had a lot of organizations trickling in too that have caught wind of what we're doing. One of those would be the VA. They had a homeless outreach coordinator who showed up at one of our events, and we're making really good connections on that front too. And the more this progresses, the more the word gets out. I'm optimistic that more organizations will show up, and we're going to keep building our team to be stronger and better.